Hello and welcome to today's session. This is the Instagram live session that we do every Friday, and today we are going to talk about frozen shoulder. I got a lot of requests from most of our patients and members where they wanted to know something more about frozen shoulder. So this is the topic that we are going to discuss today. And hi everyone. Thank you so much for joining in. And today's topic is about frozen shoulder, where we will talk about what causes frozen shoulder, what exactly is the right line of therapy when it comes to frozen shoulder, how much of importance does it holds for people who have diabetes, and what is the course of therapy? What is it that you should be really expecting if you happen to suffer from frozen shoulder? But before we start off the topic, I would like to inform you that the next session that we are doing in Bandra is on 15th of May, and we are regularly available at our Thane center for any spinal manipulation or chiropractor session. Here is my number which I am putting it, where you can actually connect and check for an appointment if you would like to see me. It is 857560040. You can connect me on this number and confirm for an appointment. Thank you so much for joining in. Salian, Praveen, Bharadwaj, Anurag, Murtuza, Kailash Hasija, Sachin Kotian, uh, Murtuza Hussain. Thank you everyone for joining in. So let's start about the topic of frozen shoulder. I'm sure everyone at some point of time have been suffering from shoulder pain. Okay, and you don't know when this shoulder pain actually becomes a frozen shoulder. By the time you realize that your pain has become so intense, or probably you have found that moving the shoulder has also become difficult. So that's where you come to know that yes, this could probably be a frozen shoulder, and it's time that you need to see your doctor. So basically frozen shoulder can happen is nothing but, it's basically where your symptoms are about pain and difficulty in moving the shoulder. Now what could be the cause of frozen shoulder? Frozen shoulder can have multiple causes. It could be just a basic rotator cuff injury, which is a very underlying normal sort of injury. It's not really that bad, which needs surgery. The reasons to have a rotator cuff injury would be in gym goers if they have been lifting too much weight or doing wrong movements. For fitness enthusiasts, if they are doing some sort of yoga or any kind of activity where their movement is not trained well, and ultimately it leads to some sort of rotator cuff injury. It can also it can also happen in housewives where they don't have a very good conditioning when it comes to shoulder strength, and if they have been into lifting some sort of weights or carrying something from different areas of their room, so this is where probably they can actually contract a little bit of rotator cuff injury, which can eventually lead to a frozen shoulder. So what exactly happens in a frozen shoulder, and what are the stages? This frozen shoulder comes to you in three different stages. So the first stage is where we call the freezing shoulder, where the pain is very much there, and you gradually start feeling that there is a little bit of restriction in the mobility also. You just feel that you can move your shoulder in a certain range, but you feel pain, and specifically you feel a lot of pain at night. You're not able to sleep on the side of the shoulder, and you typically feel a lot of pain specifically in the night. So this is classically the freezing stage. Then comes the frozen stage. The frozen stage is where the pain is relatively a little lesser, but your shoulder mobility is at risk, because you lose the shoulder mobility. You actually find it impossible or difficult to move your shoulder after a certain range. You have already committed, or you have already got used to using your shoulder only in a certain range of your activities, and that's where you realize that your shoulder is actually in a restricted range. Now this is the frozen shoulder. This is the frozen stage, and then comes the thawing stage, where you actually start recovering, where you see that your pain has reduced, your mobility has improved, and you can see that the shoulder is responding much better to treatment. Now you may be aware that a lot of people also talk about connection of diabetes with frozen shoulder. So basically the idea is that whenever if you have a person who's diabetic, shoulder issues related to shoulder joint is twice as much likely to happen than to a normal person. And the amount of recovery, if you talk about a frozen shoulder, the amount of recovery for a normal person would be something between 18 to 24 months. Okay, but in case of a diabetic it can even go up to 3 years. So that's the kind of time it takes for shoulder joint to recover. I will be answering all your questions also. You can put in your questions in the question section, and I'll be answering to all your questions by the end of this session. So I think a lot of people have joined in again, so I would like to acknowledge you all. Hey, thank you so much, Dr. Suraj Chinda, Kim, Sachin Kotian, Kailan Hasija, Yash Dave, Lalit Singh, unofficially part, Sunil Shirke, Ashvi Soni, Jinesh Chavan, Shashank 30, Hatim Rangwala. Thank you all for joining in. We were talking about shoulder joint, and we were discussing about the causes and what exactly are the stages of shoulder, where we discussed about the freezing stage, the frozen stage, and the thawing stage. Now I want to talk to you about the connectivity of diabetes with frozen shoulder. Basically, the connectivity is in such a way because of high sugar levels, it tends to attack on the collagen, which is essentially available in the shoulder area, and this can actually help, or rather, increase the amount of contraction, where you tend to have a frozen shoulder more often. So this is something which is the reason why you can have it more commonly in diabetes. And yes, the healing is very relatively slow. It may sometimes take 2 to 3 years to get the shoulder to completely get better. Okay, now one question that a lot of people have, that what should be exactly done in case of a frozen shoulder, whether you should do icing, whether you should do heating. So let me make it very clear for you. In case of frozen shoulder, icing helps most of the time. It is always seen to show very good results when it comes to icing. So prefer to do icing when you have a shoulder pain. Now, frozen shoulder. Now the question is, when do you really visit a doctor when it comes to shoulder pain? So initially, if you feel that the pain is really mild and it is only in certain range, and if you don't have any night pain and all, so you can still wait for the shoulder to recover on its own naturally. Probably it can recover. But if you feel that your sleep is getting disturbed, you have pain which is very common at night, and you find it difficult to sleep, then that's the time where you should actually visit your doctor, and you should confirm whether you are getting into the freezing stage of frozen shoulder, or if there is something more worse than that. Now, talking about positions of shoulder, because I see a lot of shoulder patients, and one question that they always ask is, what exactly should be the ideal way of sleeping, because sleeping on the affected side gives a lot of pain in the shoulder. So the answer to this is that you should try and sleep on the unaffected side. So for example, if my right shoulder is painful, I will actually try and sleep on the left side. Okay, and when I'm sleeping on the left side, I should have a cushion where I can rest my shoulder in this elbow bent position, like this, where I have a cushion and I can rest my shoulder or hug it in an elbow bent position. Now this is a minimal shoulder position which actually relaxes or stabilizes the shoulder and gives it a lot of relaxation time. Okay, so this can actually help you to keep the shoulder joint in a very comfortable position, and hopefully you don't have pain. For people who actually sleep on their back for a very long time, or tend to sleep mostly on their back, what you could do is place a pillow behind your back area on the affected side. If it is the right side or the left side, you can put a pillow under your back, in the upward area just below the shoulder, so that when you are about to turn, this turn can be prevented because of this pillow. And you can actually essentially, if you avoid the turn, you will not notice that kind of pain. And as the shoulder is elevated, it will also help you to relax or give a comfortable position to the shoulder. So this is about the positioning of the shoulder. Talking about what kind of treatment should be done for shoulder. So normally people tend to use painkillers, and they feel that just with the painkillers the shoulder range of motion will be absolutely normal and things will be better. You can try these painkillers for a week or 10 days, but if you do not see any results, it only means that you need to see a physiotherapist who can actually take care of your shoulder in terms of its movement, because if the movements are lost, it's only going to, you know, take a lot of time to get back to a normal range of motion. So it's very important that, and also even if you are in a painful stage, there are many physiotherapy modalities which can actually help you to reduce your pain at that stage. And instead of completely depending on painkillers, it's always reliable to have some sort of modality which can not only just relieve the pain, also strengthen your shoulder and help you to improve your movement in the shoulder. Secondly, what kind of exercises should be done when it comes to a frozen shoulder? So it is always suggested to do some gentle normal range of motion exercises. You don't have to get into strengthening immediately. Okay, let's say if you have a painful shoulder, or if you have a range of motion which is really bad and painful, so all you have to do is just try to move it in such a way that, you know, you can easily, or just move it in a gentle way. You know, you don't have to try strengthening, or you don't have to push too hard. There's no reason to do that. Secondly, when your shoulder is in a frozen stage where it is locked at certain angles, or you feel that you cannot move the shoulder beyond a certain range, this is where shoulder manipulation works wonders. I have seen a lot of patients where within a session we have been able to get 80% of their movement. And basically what happens in a frozen shoulder is, the problem is basically, if it is in a second stage, which is the frozen shoulder stage, well, all you can see is difficulty in moving the shoulder. So if you break this pattern, of stiffness through a shoulder manipulation session, it definitely helps you to get to the next level where you can actually start moving the shoulder, and again, you know, start working on your pain. So chiropractor sessions or shoulder manipulation sessions definitely play a major role. And my patients have seen some amazing results, and we have already posted all of this on Instagram or YouTube about all kind of results that they have seen in just one session of shoulder joint. So yes, ensure that even if you are doing physiotherapy for your shoulder, ensure that there is some sort of mobilization done if your shoulder is at a second level, which is the frozen shoulder level. Okay, so this is about the treatment that can be done for frozen shoulder. Yes, painkillers have a role to play in the first and the second stage both, whether your shoulder is at a freezing stage or whether your shoulder has already frozen. Sometimes painkillers do work, but ultimately it's always better to do some physiotherapy followed by a proper mobilization session, which can actually help you to release this pain. So this is about shoulder joint. And let me see if I have some questions. Okay, so Lalit Singh has a question. I have double slip disc L5S1 and I got it 4 years back. So now I started a brisk walking. Is it okay? Like little pain after walk. So should I continue? But pain lasts for 2 or 3 hours. Lalit Singh, don't just depend on walking for your pain to recover. See, basically, when you have a disc issue, it is not just contained, or it is not just confined to the disc area. Okay, the pain also travels and it also inflames the tissue surrounding it, which could be the muscles, and which could also be the stretch tightening of the muscles. Okay, so now what you need to do is that not only walking, but also you should look at some basic flexibility exercises which can actually help you to relieve, or rather make your muscles a little lengthen up, stretch it a bit. So when you do this, you will actually feel that walking is much more easier, and this pain, which lasts for 2 to 3 hours, will be much lesser. You can actually check these exercises on my YouTube channel. I have a specific playlist for physiotherapy exercises where I have exercises for back pain, shoulder pain, neck pain, TMJ exercises, that is temporomandibular joint. So you can check your exercises for the back and follow it. They are all absolutely safe exercises, and it will not worsen your condition, but it will only help you to reduce your overall pain. All right, so thank you so much for joining in. There was one more question about there was one more question in my story about somebody asking what exactly is cupping all about, and does it really help to relieve pain. So basically cupping is a kind of therapy evolved in China, and it's basically like, you know, putting up cups around the skin area, whether it is your neck or your back or certain areas of the legs, and it helps you to you basically suction out that skin around that area, and you try to improve the blood flow for a specific portion. A lot of times cupping has actually helped to relieve pain in certain areas of the joint, and medically there is no evidence as such that cupping does help to reduce pain, but physiologically it has been seen with a lot of patients where results have come. So it more or less becomes an integrative therapy, which means that, you know, you just cannot depend on cupping as the only sole treatment. Whenever you get yourself treated, don't feel that cupping or dry needling or taping is the only form of treatment which should be done. These are all certain interventions which can come at different levels. You know, maybe let's say a patient is doing very well with exercises and everything, but there is a soft tissue area which needs to be worked on, so you need to do a soft tissue release where a cupping can help, or probably a ISTM can help. Or if you need some sort of strengthening, or you need some sort of support when it comes to an elbow joint or a shoulder joint, so maybe you do some taping once the therapy is completely over with the patient. So it's like these are different situations in which, you know, you actually would need cupping therapies like cupping or dry needling. So I wouldn't say that you can completely depend on it as one source, but yes, it is always an additive therapy and it will help. Atul Singhal has a question. How many sessions needed for shoulder pain? Atul, shoulder, as a, I wouldn't really confirm as the number of sessions it would take, because it really depends on the stage, which stage of shoulder you are in. If you are in the freezing stage, probably 2 to 3 sessions would be good. If you are in the frozen stage already, where, you know, your mobility is restricted quite a bit, then probably additional sessions may be required, and this is all subjective to the kind of exercise and to the kind of stretching sessions that you would be doing. For all the patients who are looking for some exercises for shoulder, please log on to my YouTube channel. You can check YouTube/Joints in Motion, or you could also check YouTube/ Dr Sudarshan Singh, where you will get a playlist on physiotherapy exercises. And I have a specific video for shoulder joint where I have spoken about the first stage, the treatment which is required in the first stage of shoulder joint, and how it can help you to take care of your shoulder by doing some gentle exercises. So thank you so much for joining in, and do write to me what other topics you would want me to discuss on, and I'll be there next week on Instagram live, where I will be discussing a certain topic with you once again. So do put in your questions, and thank you so much for joining in. Take care. See you all. Uh, Therl man, thank you for the info on cupping. I wanted to know what frequency is needed for performance athletes. It completely, as I told you, it completely depends on your need. Okay, and if you have any complaint, don't feel that cupping will actually improve your sports performance. Only if you have a issue, whether if it is a back related issue, neck related issue, or a muscle injury, only then is where you need to do cupping. So think about it from that perspective, and normally 4 to 5 sessions are good enough when it comes to doing cupping, but your therapist will be in a better position to decide about how, depending on your condition, as to how many sessions would really be required. Thank you everyone for joining in once again, and see you all next week. Till then, stay safe, stay healthy, take care. Thank you so much.